Should I get a flu shot? It's a decision that we make every year. But before we answer whether it's worth taking the time out of our busy lives to get the flu shot, we should understand what it is.
Flu shots are vaccines, and vaccines contain antigens from the flu, and it makes the body create antibodies which are protective against the virus.
But how effective are these flu shots? And why are we encouraged to get them every year? There is no guarantee that a flu shot will prevent you from getting the flu, and since 2009, flu shot effectiveness has constantly varied.
CDC and other bodies of learned public health officials recommend flu vaccine for all adults and children over the age of 6 months. Some years more effective than others, but yes, in general, it is a good preventive vaccine for influenza.
But given this, many people do not get a flu shot every year. More specifically, people in the 18 to 49 year age group, which Yaleys fall into, choose against getting a flu shot at a higher rate than the general population for a variety of reasons.
I think that certain populations are more interested in the protection that the flu vaccine affords. Older people, for example, are much more careful about getting the flu shot and thinking much more preventively than, for example, college students may. But we certainly encourage students to get the flu shot as well.
Some people, for example, are frightened that the antigens in a flu vaccine might actually give us the flu at first.
Some people do have some slight reaction to the flu shot because what the flu shot does is to make the immune system react against the antigen. So obviously there's soreness around the site of injection, and sometimes people do get a little ill from the shot itself. But it's extremely severe when you actually get the flu. You're down for 2 weeks, high fever, chills. There's nothing you can do about it. So a couple of days of downtime is nothing compared to the actual illness that you will experience.
Even so, many people reason that they have strong immune systems and almost never get the flu. They would rather take the gamble, but it's not always about them.
Although it is not usually a dire illness in otherwise healthy young people, it does have the potential to be an extremely severe disease. In addition, there's a public health reason for the flu vaccine, which is that we try to have as much of our population immunized as possible as a protective measure for the whole population and for the most vulnerable people in the population. And those are, for example, infants, extreme elderly, or people who have chronic health conditions.
So, in essence, you are not getting the flu shot only to protect yourself, but also those around you. And here at Yale, it is easy for the flu to spread.
We have so many people cohabitating and living in dormitories type settings, working close quarters together. When someone gets sick, the virus is highly contagious, spreads so easily, and we already see cases in Connecticut.
We offer it free of charge. That's irrespective of whether a person working at Yale or studying at Yale is a member of Yale Health plan.
So I'd certainly like to invite all students, waived or otherwise, to come on down to any of our flu clinics. Look online at the Yale Health external website. If you miss those opportunities, feel free to come here to a second floor to our preventive health department.
These flu clinic events and times can be found on Yale Health's website and include locations around campus such as the Schwartzman Center, Yale Medical School, and the Yale Health Center. So, should I get a flu shot? When you make your decision this year, consider this.
So you're willing to take a chance on your health. What about if you ended up with the flu and you passed it on and it was to a pregnant woman or an elderly person with other illnesses, and they can't fight it because they don't have the strong immune system that you have. So if not for you, for others, that's my plea.
For YTV, this has been Joe Kim and Neeraj Patel reporting.
Largest collection of British art outside the United Kingdom, a gift to Yale University from Paul Mellon, class of 1929. Open to the public in 1977, one of the center's greatest treasures is the building itself.
Louis Kahn was designated